In April of 2019, Washington State Legislature passed House Bill 1638. This bill removed the ability for people to submit an exemption for personal and philosophical reasons to the MMR vaccine, while still allowing for religious and medical exemptions. House Bill 1638 applies to all students enrolled in public and private schools in the state of Washington, as well as school employees. Proof of vaccination is required for enrollment in any school or licensed daycare setting. We propose an addenda to House Bill 1638, which removes the ability to apply for a religious exemption. We also propose that all childhood vaccinations are included in this bill. With all exemptions currently at 4.7%, this should reduce the exemption rate to below 1% for students entering kindergarten. 2018 data reveals that Washington State is hovering around 86% of students entering kindergarten with completed vaccinations. Adding an addendum would increase the chances for reaching the Healthy People 2020 goal of 95% vaccinated.
People who choose not to vaccinate themselves and their children pose risks to others in the community. Non-immunized persons are more susceptible to infection because they weren't vaccinated initially. Babies are at risk also because they are too young to be vaccinated. Immunocompromised patients have weakened immune systems, which makes them more susceptible to infections. And lastly, life-threatening allergies to vaccinations. This set of patients are unable to receive vaccinations because anaphylactic reaction occurs. Many resources are utilized in the community to prevent the spread of infection. These resources range from hospital establishments, healthcare workers, government employees, community leaders, investigators, rehabilitation centers, public health workers, lost time at work school, and police emergency management are all just small examples of the parties involved with dealing with these outbreaks. Money is being allocated to control the damage when this can be prevented. Families need to realize that when they don't vaccinate, they are putting others at risk, not just themselves. The pros of passing this policy is providing a safe community where the infection rates are low and can be controlled. This promotes a healthier standard of living. Infections can be minimized and monetary resources can be assigned to other beneficial projects. Community members may be angry with this policy as they feel it's an infringement on their rights. It may contradict religious beliefs and cause uneasiness in trusting the government and healthcare systems.
Our group has decided to revise the current Washington legislation, House Bill 1638, that was recently amended in 2019 after a measles outbreak plagued the state of Washington. The amendment indicates that a philosophical or personal objection may not be used to exempt a child from the measles, mumps, and rubella vaccine. We feel that this amendment, although is a step in the right direction, is not strong enough to accommodate all of the other required vaccinations that are recommended by the CDC. The neighboring state of Oregon, in fact, had a bill that is more stringent and more appropriate for the prevention of these types of outbreaks. Oregon House Bill 3063 removes the ability of parents to decline immunizations for any reason other than an indicated medical diagnosis. This would include personal, philosophical, and religious exemptions. We believe that the Washington House Bill 1638 can be strengthened by including all CDC recommended childhood vaccinations be required for the public school enrollment, and to eliminate all non-medical exemptions. This would include personal, philosophical, and religious exemptions from the requirement. In addition to making the adjustments to the legislation in the state of Washington, we believe it's very important that the state continue a public health campaign in relation to childhood vaccinations. Boost Oregon is an organization and a very valuable website that the neighboring state of Oregon has put together with similar types of education materials, not only for parents, but also for providers. This can include training on how to talk to families about vaccination scheduling and also how to promote evidence-based practice amongst pediatrician groups. These types of public health campaigns could also include focused rural outreach for small communities and even organize immunization clinics routinely. We think it's important that the state of Washington recognize that other states have already done this in their legislation. California, Mississippi, West Virginia, New York, and Maine currently have no non-medical exemptions for childhood vaccinations in public schools. And Oregon, as we mentioned, will be enforcing this August 1st of 2020. And that is coming from a state that previously was leading the nation in exemptions at 7.5% of kindergartners.
There are only 5 states in the United States that have enacted a law requiring children in public schools to be vaccinated, with the exception of a valid medical reason: New York, California, Maine, Mississippi, and West Virginia. The preferred course of action for the state of Washington is changing legislation, passing a bill that would eliminate personal, philosophical, and religious exemptions for all childhood immunizations in the state of Washington. And education. Counseling by healthcare providers may be an effective way to reduce vaccine exemptions. AB 2109 in California reduced personal belief exemptions statewide from 3.1% to 2.3% in a 2-year period. Also, pro-social aspects. Informing individuals about the social benefit of herd immunity has been shown to increase vaccination intentions. Anticipated challenges. Anti-vaccine groups contribute to a drop in vaccination compliance. These types of groups have a strong presence on social media and well-developed websites. Religious groups. The only 2 religions practiced in the United States that openly discourage vaccination is the Church of Christ, Scientist, and the Dutch Reformed Church. However, many religious groups are opposed to immunizations and will contend religious freedom if forced to receive immunizations. Unintended consequences. Increased medical exemptions. However, these may be fake. Some valid exemptions include undergoing chemotherapy, having a gelatin allergy, or suffering from a severe immunodeficiency disorder. Other medical conditions may warrant a medical exemption. Also, parents may choose homeschooling to avoid immunizations.
With the invention of immunizations, diseases such as measles was able to be eliminated in the United States by the year 2000. However, in recent years, we have seen an increase in the number of parents and individuals who are choosing to delay vaccines or to decline vaccines for religious, personal, or philosophical reasons. Because of this, in 2019, we experienced a measles outbreak in the United States. In response to this outbreak, Washington State has taken a small step with the passing of House Bill 1638, which eliminates non-medical exemptions for the MMR only. We hypothesize that by eliminating the allowance of non-medical vaccine exemptions for all CDC recommended immunizations, children entering the Washington State public school system will serve the greater good, and in protecting themselves against preventable diseases, they will also be protecting vulnerable patient populations from life-threatening illnesses.